Everybody, this is our last lecture. We'll be covering eye and ear disease and disorders. Got my Hawkeye mohawk on, my mohawk eye. All right, sooner we start, the sooner that we'll be done. So the sooner then you can start studying for your finals. So let's begin. All right. So we're going to start with the eyes. Common signs and symptoms leave the patient with any visual disturbances, pain, burning in any part of the eye, eye redness, photophobia, so it's affected by light, which is light disturbances. Get familiar with the eye anatomy here because some of the diseases affect only certain parts of the eyeball. So refractive errors, these are defects in visual acuity and eye's inability to focus on light and the surface, focuses light on the surface of the retina, which is the back of the eye. It's that thin layer in the back of the inner eye. Hyperopia is the farsightedness. Presbyopia is a loss of elasticity of the lens, a fair consequence of aging. Myopia is nearsightedness. And then the astigmatism, that's where you have variations of the curvature of your the lens or the cornea. Signs and symptoms here are visual disturbances and squinting. To diagnose, testing is done on a patient's visual acuity. So here's an example on how that is done. And this is the Snellen chart. There's also the ophthalmoscopic exam. That's where your eyes are dilated, and that lets a physician take a closer look on the inside. And then tests are done to determine muscle function as well. All right, a little nasty. This is a sty, medically known as the hordelum. This is localized purulent, so that's purulent is pus forming, inflammation, infection of one or more sebaceous glands of the eyelid. It commonly occurs on the skin surface and at the edge of the eyelid or the surface of the conjunctiva. The culprit, staphylococcal bacteria. In most cases, visual examination is sufficient, though a collection of the discharge can be cultured to isolate the staph organism. The image below is an electron microscopic image of what staph could look like. Corneal abrasion. This is a painful scrape or scratch of the cornea. This abrasion can arise due to foreign bodies, fingernail scratches, poorly fitting or scratched contact lenses, and then also like excessive eye rubbing. Any ulceration of the cornea can cause permanent vision loss. This picture here is of an eye that was given a fluorescent, like an eye droplet, to help visualize any corneal damage. And so you can see that scattered dusting at the bottom of the iris yields a positive test or a positive result. Cataract. Cataracts, this is a gradual clouding of the eye's crystalline lens or its surrounding membrane. It can happen in one eye or both bilaterally. They affect visual acuity and it is very common in elderly clients. Cause can be due to change in chemical composition of the eye lens, which forces a loss of transparency, and it's also the result of just aging, injuries, some diseases. There are genetics and birth defects that may make someone more prone than others to a cataract. Oh my God, I get like itchy eyes right now. Okay. Cataract continued. Signs and symptoms of a cataract would be a gradual and painless loss or blurring of vision. You'll be seeing, or the patient will be seeing halos around lights, and in mature cataract, eye pupil may appear white, like in this image. Ophthalmoscopy and penlight exams are used for diagnosis. Glaucoma. Glaucoma is an eye disease where the aqueous humor is produced faster than it can be drained from the eye. This is fluid pressure that builds up within the eye and damages the retina and optic nerve. It often causes blindness. Etiology, there's an open angle glaucoma is idiopathic. Genetic links are possible, though it can arise secondary diseases and toxin or medication exposures. Glaucoma has no symptoms until irreparable damage has occurred. So you want to get your eyes examined pretty regularly. There could be an aching, though, felt in the eyes, or maybe visual disturbances, halos around light, It has also been recorded that a loss of peripheral vision, so your side vision here, to diagnose, tonometry, as shown here in this image, measures eye pressure, and it's just a gust of wind that blows into your eyeball. Ophthalmoscopy exam and vision field testing would help in the diagnosis as well. Pop quiz! Glaucoma is caused by overproduction of what? Answer is aqueous humor. It's the fluid in the eye. Okay, let's talk about retinal detachment. Oh, let me move the slide here first. Okay, now let's talk about retinal detachment. I reposted this eye anatomy again just so we can get a visual of the retina again. Visual, but no pun intended. Okay, this disorder is a complete or partial separation of the retina from the choroid layer of the eye. The retina is, in our image, it's this thin layer on the choroid is the red layer outside of that. The detachment leads to the loss of retinal function and blindness. The result of hole or break in the retina allows vitreous fluid to accumulate between the layers, and that's just going to exacerbate the condition. AMD, age-related macular degeneration. This is a very slow yet progressive change that occurs in pigmented cells of the retina and macula. It results in loss of fine vision in one or both eyes, leading cause of new blindness in the United States. There are two types. There's a dry non-neovascular AMD and a wet neovascular AMD. The dry type encompasses about 90% of the cases. It begins in the middle age, or it begins in middle age, progresses. The wet type would have a sort of abrupt onset. Vessels leak, hemorrhage, and form scars that would ultimately result in vision loss. Generally, this affects persons over the age of 60, disregarding gender. AMD comes with risk factors that could speed up the progression of this disease. So advancing in age, hyperopia, familial tendencies, smoking, high blood pressure, and even eye color with light irises could predispose you to AMD. Signs and symptoms: the appearance of drusen or spots on the retina. This would take a professional to see them, but also a sign: painless vision loss or distortion. And the distortion could be used with the Amsler chart imaged here or fluorescein angiography. A bit more common and not typically blinding, we're going to talk about conjunctivitis, pink eye. This is highly contagious and is an infectious of the conjunctiva. It causes small blood vessels in the conjunctiva to be more prominent, giving a pink cast to that whites of the eye, hence pink eye. It is the most common eye disease in the world and usually lasts up to 2 weeks. It is caused by bacterial and viruses. Transmission is done from hands contaminated or contaminated washcloths, tissues. It could, but is not seen as often, caused by irritation from heat, cold, chemicals, allergies, and UV light. You should always protect your eyes against UV light. Eyes suffering from pink eye get red, swollen conjunctivae. So this is the mucous membrane of the eye. It causes itching and burning along with tearing and light sensitivity. Most of those symptoms are a way of microorganisms trying to trigger the patient to itch the eye, which would thus increase the chance of spreading that bacteria to a new host. To diagnose if an eye exam is not enough, there can be a culture and sensitivities done to determine the bug that is bothering the eye and, in order to treat it, and then hopefully with some form of antibacterial drops. Pop quiz. The conjunctiva is the blank of the eye. Answer: mucous membrane. You might want to know the names of the other definitions here too. All right, now on to uveitis. This is the inflammation of the uveal tract, which is the principal vascular connection tissue of the eye. This inflammation may be caused by autoimmune disorders, or it could be idiopathic. It may also be caused by bacterial infections or a debilitating disease such as AIDS, TB, which is tuberculosis, herpes zoster infection, histoplasmosis, or may result from improperly healed corneal abrasions. Allergies, chemicals, trauma, and surgery also play a role in that etiology. What's this one? Blepharitis. Blepharitis is the inflammation of the edges of the eyelids that is commonly ulcerative or non-ulcerative. But either involve the hair follicles and glands that open onto the eye surface. There are two types. Anterior blepharitis, which appears on the outside front edge of the eyelids where the eyelashes attach. And then there's posterior at the inner edge of the eyelid only. The ulcerative version forms usually as a result of an infection of, you guessed it, staphylococcal bacteria. Staph causes all kinds of problems when they wind up where they don't belong. He's like the guest at the end of a party that just won't go home. Anywho, so the non-ulcerative form is usually linked to allergies, exposure to dust, smoke, or chemical irritants. Keratitis is the inflammation of the cornea that usually occurs unilaterally, uni relating to just one. Etiology is most frequently due to an infection by the cornea by the herpes simplex virus. It may also be caused by certain bacteria like staph again, this time more specifically Staphylococcus pneumoniae, and then also a different gram-negative bacteria, Pseudomonas aeruginosa. This disease can arise secondary to syphilis, and the non-infectious form of keratitis can be caused by prolonged exposure to dry air, intense light, also from possible corneal trauma. Alrighty, we're ready to move on to our last region of this semester. We did it! We are going to be talking about our ears now. Common signs and symptoms of ear disorders are hearing loss, ear pressure, loss of balance, pain, and dizziness. Here's an image of the ear anatomy. Notice the bottom brackets. This distinguishes the outer, middle, and inner ear portions. You'll hear me referring to these areas in just a bit, or you'll see images denoting which region. All right, the first ear disorder is a little gross. It's impacted cerumen. Cerumen is just earwax. When impaction occurs, the soft brown wax-like secretion found in the external ear canal accumulates abnormally. Here's something that might shock you. The earwax or cerumen can become impacted due to overuse of the ever so popular Q-tips. The action of using one of these devices actually pushes earwax further into the canal. So the cerumen should not be removed if impacted. Impaction can cause temporary hearing loss. External otitis, or swimmer's ear. This is the inflammation of the external ear canal. Again, this is a result of a fungal infections from swimming, also from a scratch, or potentially from eczema. This could result in a bacterial infection if not addressed. Otitis media is when fluid accumulates in the middle ear. It can be acute or chronic and happens very often in children. There are two forms again. A clear sterile fluid, which would be serous, and then there's the suppurative fluid, which is what is produced from a pus-producing bacteria. Otitis media, when acute serous, can occur spontaneously or can even follow an upper respiratory infection or rapid changes in atmospheric pressure. The serous chronic form tends to follow an acute infection, overgrowth of the adenoidal tissue, or chronic sinus infections. All right, to continue with otitis media etiology, let's talk about the suppurative form. This is caused by the pyogenic microorganisms in the middle ear. It tends to follow after flus or colds. Those with short, wide, more horizontally placed eustachian tubes, so horizontally like left and right, they are at greater risk. This short, wide, or horizontal tube can be genetic, but it is also seen in younger children. But as a child grows, the tube begins to tilt and occurrences of otitis media go down. Signs and symptoms vary with severity of the infection. Sensation of fullness or pressure in the ear can be felt by the patient. Pain can relate to symptoms of an infection. You get dizziness is felt in the ears because our ears are related to our balance. And there could also be a varying degree of hearing impairment. This is important to note, and if it's bad enough, could hinder the young child's mental development with speech and communication. Okay, to diagnose otitis media, an otoscope exam is performed. So when they're putting that otoscope in the ear, they'll see a red discoloration can be seen on the eardrum, even fluid or bubbles behind the eardrum. If blood is evaluated, they could notice elevated white blood cells in this suppurative otitis media. But why do you think the white blood cells would be higher? I wish I could ask you guys in person, but to discuss that, I want you to remember that the suppurative form is a result to pus-producing bacteria. So if a white blood cell count is high, it may be as a result of the cells responding to and fighting a bacterial infection. So that's why we could potentially check blood for an ear infection. Okay, pop quiz. The fluid in the serous type of otitis media appears what color? Bloody, cloudy, thick, or clear? The answer is, there it is, clear. All right, let's move on to another disorder. Motion sickness. Who out there in Cyberland gets car sick? I do, and so does my son. This is a nausea, vomiting, vertigo-induced feeling that is brought on by irregular or rhythmic movements like planes, boats, cars. This causes any motion that disturbs the equilibrium of the semicircular canals of the inner ear. Let's see here. So how is this diagnosed? Really? Just history and complaints. There's no real test that can be done. Just the patient's word and the need for a puke bucket on any road trip. Yay! Okay, on to Meniere's disease, or Meniere's. I'll just probably pronounce it Meniere's disease. This is a chronic inner ear syndrome marked by vertigo, progressive deafness, there's tinnitus, and then a sensation of fullness in the ear. It usually appears in patients between the ages of 40 and 50. Causes are mostly unknown. It appears to destroy hair cells in the cochlea in the inner ear. When those hairs are damaged, there's no fixing them. A rupture of the membranous labyrinth also, the rupture of the membranous labyrinth allows endolymph to mix with perilymph, which may bring about symptoms as well. So other possible causes could be noise pollution, viral infections, and there are biological factors. Classic signs and symptoms of Meniere's disease include severe vertigo, tinnitus, sensorineural hearing loss, I'm so sorry. There is nausea, vomiting again, sweating, and loss of balance. I want to make a little side note about what tinnitus is. Sometimes you'll hear it pronounced tinnitus. This is a constant ringing in the ear that never goes away. So I know I've referenced that as signs and symptoms before, and it was in your text. To diagnose the Meniere's disease symptoms, history of the symptoms helps. There's also an audiometry is performed, radiographs of the internal meatus, and an MRI can help get a full look of what's going on inside the ear. Okay, last disorder is hearing loss or deafness. This can all involve one or both ears. There's many forms of this disease. It ranges from mild to moderate or severe. It is more commonly seen in elderly clients. Deafness or hearing loss can happen if the patient is congenitally predisposed. If there was trauma or if there was infections, osteosclerosis, damage to nerves, and also there's always the unknown reason, which would be idiopathic. Oh, wow. All right, we're here, everyone. You did it. Congrats. Next week is finals. Here are some things to help you guys focus on for studying for your final exam. Typically, testing standards are, typical testing standards are still relevant. So that means you're going to be taking it at a testing center, unless otherwise specified due to COVID. Please do not hesitate to reach out if you have any questions, and then continue to check on Talon for any last minute updates. I do hope to see you all next year, and I wish you the best of luck.